My name is Akaco, Ekirapa, and I'm the new Data Demand and Use Advisor for this office in Nairobi.
Excellent.
Yeah.
And what will your job responsibilities be?
I'm primarily mandated with providing technical support regarding reproductive health issues in terms of creating demand for the data and also working with people in the district and also at national level just to improve data demand and use nationally.
How do you know yet how we will create a demand for data? How will we go about that?
Well, my understanding is we're already working with the existing systems within the national structure. So it's just a matter of trying to streamline the processes of data because, of course, data is being collected, but probably the issues of availability of the data and also the users, like, for example, the policymakers or the program managers, getting them to understand the purposes of the data and why it's important.
How will we capture use of data?
Use probably, like right now what we're trying to do is find out at the district level, like following the trainings that we've been doing, like what have they learned from the trainings and are they using it?
Okay.
And there's a new assessment we're actually planning to do now that will also give us information on that. And also at national level, we also have certain indicators that we're monitoring just to determine whether data use is actually increasing over time. And I believe it has been, particularly because there have been many trainings and workshops on monitoring and evaluation.
Good.
Yeah.
Excellent. And before coming to Measure Evaluation, where were you previously?
I was working as a research officer at African Population and Health Research Center. So basically, I was involved in reproductive health programs and a project that was a 5-year project where we're trying to increase family planning uptake in Western Kenya.
And what experience do you bring to Measure Evaluation from your previous position?
I have been heavily involved in monitoring and evaluation, particularly with collecting data and also in trainings and working with the district health management teams. And so I believe my experience on the ground will also help me be able to take this up to the higher levels with policy and also be able to address some of the issues that we have nationally.
And what are those issues?
One, we tend to find capacity is very low at the community level. So that's one thing we need to do is to strengthen capacity at the community level. And also, we also find sometimes the data doesn't get to the people who need to use it the most. For example, as Kenya is now moving towards the county system, you may find that a lot of the counties haven't even collated the data for their counties. So that would also be important for us to be able to capture data that people can use and also so that they can be able to know how to allocate resources.
Excellent.
Yeah.
And this is my last question for you, and that is, why is monitoring and evaluation important, and why do we even do it?
Well, of course it's important for tracking like how you use resources, and also it's also good just to have records because you can't just be implementing programs without monitoring what you're doing and finding out, are you meeting your targets, are you not meeting them? And if you're not meeting them, why are you not meeting them? And it also helps us put measures in place. For example, if you find there's an outbreak or something in a district, you're able to address it immediately rather than just having people doing their work and we're not having any interventions.